Having treatment for cancer can mean your life changes for a while. You may need to spend time in hospital and make regular visits to the clinic. Your relationships with friends and family may change, and the type of activities you feel up to can be different for a bit.
Friends are important. Keep in touch by text or social media. Invite them to hospital to share some time, or include them in some of the activities and events. Meeting other patients can be a good idea. Going through things together, sharing experiences and having a laugh can sometimes be easier with friends from the hospital.
If you feel up to it, get out and about when you're at home. Planning nights in with friends is a good idea too. Pace yourself a special event, relax and chill out the day before. Some activities like go-karting and theme parks are the type of things that could prove dangerous on treatment, so always check things out with your doctor or nurse.
Discuss any holiday plans at home or abroad with your doctor before booking. Sometimes booking trips abroad is better left until treatment is over. Time out on your own at home can be important too.
Everyone reacts differently to both the news they have cancer and to the treatments needed for recovery. This means there are no exact rules about continuing with education or work. Some treatments mean that you could continue your plans, although these may be disrupted at times with clinic or day patient treatment.
Sometimes though, taking time out to go through and then recover from treatment is the right thing to do. Talking to your family and hospital staff will help you with these decisions. Hospital teachers and clinic sergeant workers can often support you to continue your studies. They can help explain your situation to tutors and employers if needed. You may also be entitled to sick pay or benefits during treatment.
Help is also available when you have recovered to pick up your plans or decide on new or different choices.
Relationships, generally, can change when on treatment. You may notice this more in your personal relationships. You may feel different about the way you look and feel. Surgery and medications can alter this too.
Your energy levels and sex drive may not be the same. If you have a partner, you will both be experiencing changes in your lives that can be confusing. It is important to talk to each other about how you are feeling. For most people, things return to normal once they recover and treatment is over.
If you are having any type of sex, then barrier contraception is needed. It may be possible that small amounts of the drug used in your treatment can be passed during sex. It is important to use condoms to guard against this and against infection.
Some medicines and treatments may not fit together well with some types of contraceptives. If taking the pill or you have an injection or implant, please tell your hospital. Your pill may not work if you are sick or have diarrhea. If you have questions about your sex life, then hospital staff can help. There are leaflets and websites too.
If you think you or your partner may be pregnant while you're on treatment, it is very important to let a hospital doctor know. You will receive advice and confidence to ensure the safety of all involved.
If attending your GP, A&D or a sexual health centre for anything, then it is important you tell them about your diagnosis.
Fertility means your ability to have children in the future. Infertility means you will not be able to have your own biological children.
Some treatments will have little or no effect on your fertility. Others will have a high chance of causing reduced fertility or infertility. Your doctor will discuss this with you as it is different for everyone.
If you have questions about your fertility at any time, during or after your treatment, then the hospital can refer you to a specialist doctor. There are also booklets available if you want more information. Effects can be uncertain, so always use reliable contraception.
It's good to enjoy time going out with friends. It's important though to think ahead about a few things. Check that your phone is charged and that you've got credit. Know how you're getting home. Stick with your friends. Let one of them know who to call if you become unwell.
Don't forget, when you've had alcohol, you might take risks that you normally wouldn't. When you've had your beer goggles on, things might not seem so great in the morning. Alcohol and chemotherapy often doesn't mix. Remember, your body is already working hard to deal with your treatments.
If you smoke, then your doctor will want to talk to you about this. The best thing is to look to giving up. There's a range of ways to cut back and stop. The hospital staff can arrange a pharmacy advisor to meet you to work out a plan.
During treatment, there will be medicines and tablets that the hospital want you to take. Taking other drugs, legal highs, or substances will prove very dangerous. Let someone at the hospital know if you're taking anything, or have done in the past, as it will help to keep you safe. Your doctor or nurse must keep this confidential.
It is very important, though, to take medications that are prescribed for you. If you are struggling, then tell your nurse or doctor. It may be possible to change it for a different tablet or medicine, or give you ideas to make it easier.
Tattoos can be great. However, wait for any new designs until your treatment is over and your consultant tells you it's safe.
Keeping active is always important, as your body releases its own feel-good factor. Sometimes though, treatment can leave you really quite tired and worn out. The exercise or sport you usually enjoy may just be too challenging. The hospital may ask that you hold off certain activities until treatment is over and you are fully recovered.
Any activity is better than none and is important during treatment. It can help look after your bones and boost your mood. It can benefit your sleep, improve tiredness and help your appetite.
Playing pool or table tennis can get you active. Have fun with dance and active games. How you feel about physical activity can vary from day to day, but even things like climbing stairs or taking walks are ways to keep moving.
Doing something little and often each day can help build up your strength. If you are looking to do something a bit more challenging, ask your consultant or physiotherapist to help you plan this. Being active is safe and has lots of benefits.
There's a lot to get your head round, but the hospital staff can help you with any questions, or if you just need a chat. Your views and opinions are important in the decisions about your treatment and care.
You can expect privacy, respect, and confidentiality.
The unit welcomes your family and friends, if you choose to have them alongside.
We hope you will enjoy some of the activities and trips when you feel up to it, and take these opportunities to meet new friends from the unit.